incisors. Usually, this children family they come and they ask doctor, my son teeth is big. The answer, it is not big. The size of the teeth, it is not changing. So the facial skeleton is small for the children. Then it's big. So when he grow up, these teeth will become normal. This is the answer. All right. So the overjet, look, once it is arrived, it is coming out. All right. The protrusion of upper incisors, it's coming like this. This is protrusion. Insufficient lip closure. When he is trying to close his mouth, he cannot close it totally. It's open. All right. This is what is the injuries. Usually, it's become after the sport, and the percentage is between 1.5 and 3.5. The horse bite, it's very dangerous. I saw many cases caused by the hit by the horse, especially with children. All the facial bone was fractured. It's very, very, very bad fractures. The heat, be careful with the animals. The percentage also. The bicycle also. Sport. See, usually when we see a fracture, this is the kind of fracture. See, this is dentoalveolar fracture. What it means, dentoalveolar? The teeth is inside the alveolar.
Yes.
Once the bone is fractured, so this is the alveolar socket also is moved together with the tooth. All right. This is a complicated case. The maxilla bone is not fractured. Only the alveolar bone is fractured and the teeth is fractured. Okay. So you can see here, this is why this one happened like this? Something wrong. What is going on?
GLB2.
Can you scale for me?
Okay. So this is the kind of fractures here. Which one? This one?
Upper. A little bit upper.
This one?
Focus.
Oh, sorry. This one.
No, no.
Aye.
But this is coming small. Okay, so this is the fracture of this. This is called class 4 fracture. Okay, and this is the injury. The tooth is, we say, intrusion. It's gone inside, and this. Okay, we are going to explain. This tooth is lateral incisor is broken because of playground, school, dash, all. See, in boxing also, in car accident injuries, you can see the dashboard also is very common. So he's telling the age distribution, it's between 8 to 13 years, the highest incidence you can, between the age, peak at the age, because at 7 years old, the upper incisor is erupted. And we usually between 8 to 10, we can see this the higher percentage. All right. The sex, the boys is 100. This is a statistic study. The boys are higher than the girls because the shayateen actor. Incidence of injured teeth. Okay, the upper central incisors is more than the lateral incisor. You see, 85%. The lower central incisors is less. The lower is less. Okay, the anamnesis. General anamnesis, circumstances of injury, we are going to speak about this, okay? Dental anamnesis. Most important question, you have to ask the parent, when this happened, time passed between the injury and the treatment. This is very important question. As if a tooth, the parent come and the tooth is in the hand, you have to ask how much time elapsed between the injury and you are here now in the clinic. In the first 30 minutes or 1 hour, if you put the tooth after, sure, I will explain now. how you wash it and you treat it. If you put in the alveolar socket, the chance of survival is more than if somebody come after 2 hours or 3 hours or next day. Where this happened, you have to know, is it in the salt or in the sea or some dirty place, and how this happened, the mechanism of the injury. Is it a fight, trauma, burning or something like that? You have to know the incidents. The time, the elapse after injury. Usually they come in the zero date. The same day nobody come. They come, but it's very few. If they come in the first day, is the best time. Because usually the parent, they want to ask who is dentist, who is doctor. If it's happened in the night or something like that, the clinic will be closed. The first day, the most people they will come. Second day, you see the date. First week, second week, less, like that. All right. Either they will come immediately or next day, or they will leave it. After 2 months, 3 months, 6 months, they will come to do replacement or something like that. Because I saw some children, they come with swelling after 1 year. I asked them why you didn't come the same day. They said we don't have pain, we don't have. But what happened after the trauma? The pulp is necrotized and started infection. Then they came to treat the infection. They didn't come to treat the tooth. Okay, so clinical examination, you have to do always extraoral examination. You want to see if there is any wound or something like that, dirty wound. Intraoral examination, if there is also inside the oral cavity. If there is missing teeth, you have to see all, find them. If there is a milk tooth disappeared, photo documentation, take a photo for the case, and you do X-ray. Why we have to do X-ray? Because some trauma, the tooth, nothing happened, but you will see a fracture line in the X-ray. Okay. Type of injury, traumatic injury involving the permanent teeth, the alveolar bone, the soft tissue. This is a permanent tooth, okay? The alveolar bone is this one. See the bone, this is the alveolar bone. The tooth is in the alveolar. This is the gum. You can see the fracture line in the middle third, and this is in the X-ray you can detect this one, all right? Sometimes you cannot also. The patient will tell you, I have pain in percussion. Sometimes the fracture will be only in the crown. See? This one is called dentoalveolar fracture because the alveolar bone is fractured and displacement of the tooth happened here. The classification of the fracture, there is coronal fracture, as I spoke. This is coronal fracture. Coronal and root fracture. This one is coronal and root fracture. Root fracture alone. This is sometimes will happen only alone. Fracture of the process alveolaris, it could be only the alveolar bone, nothing happened to the tooth. And the soft tissue sometimes will be only the mucosa which is covering here, it is injured, like somebody putting a pen in the mouth and something, and nothing happened to the tooth, all right? Classification of dental injury, luxation totalis, the tooth will come totally out, or it will come partially, change the place, or it will go inside the alveolar, okay? Or it will be only the fracture of the crown, the dentine it will be fractured, or fracture of the roots. This is the classification of injury. Avulsion, it's mean complete displacement of the tooth. It's come, see the empty. The cavity is empty. Here we have to take X-ray to confirm nothing remained inside. If the wound is dirty, we have to wash it with normal saline and clean the cavity gently. We don't want the ligament to be destroyed here because if the tooth is with the patient, we have to put immediately in the place, okay? So loosening of the tooth or a partial displacement of the tooth out of its socket. We talked about this? No. Subluxation, this one is subluxation. The patient have pain on percussion. If you hit the tooth, he will tell you I have pain. This is subluxation. Lateral luxation, this one is called lateral luxation. Extrusion, it's come out of the socket. All right, this is the word you have to know about it.
Doctor, you took the percussion for the crown?
Yes,
on
the crown. Just take something, mirror or something like that, and heat it. He will tell you I have pain because now it entered inside. What happened in intrusion? It's very important, please. If the blood vessels is coming inside here and the tooth gone inside intrusion, what will happen? The blood vessels will be smashed, crashed, then will start necrotize because there is no more supply for the tooth. This is important also. All trauma to the teeth should need observation, follow up. Till the patient tell you, I started feeling cold, I feeling, then you will be comfortable. Need X-ray follow up. At least 1-2 years you have to follow him to see is it the pulp necrotized or not. If it is necrotized, immediately after 15 days or 20 days he is not feeling sensitivity, cold or hot, you have to remove the pulp and do endo for him, and put calcium inside. Because if you don't do that, periapical infection will start. Clinical examination, the subluxation, sensitive to touch, the clinical examination, the subluxation, changing the place little. It is, if you touch the tooth, will tell you I have pain, slightly mobility, no displacement. Okay, the subluxation, there is no displacement. Bleeding little, the extrusion, it is coming out. It will be either axial, it will come totally out axially, or it will be lateral displacement. This one is called extrusion, or it will be mobile. Okay, in lateral displacement, the tooth sometimes it is not mobile because it is locked in the alveolar bone. Then you have to anesthetize and do reduction, the bone and the tooth. Okay,
The lateral, it doesn't go out.
and the lateral, no, the lateral I explained to you. See, this is the lateral. See, this is the lateral extrusion. The alveolar bone is bone, it is locked here now. Then you have to put this piece of bone here and put the tooth into place. But this you cannot do it by force, you have to use force. You have to inject, anesthetize, and you go on. Okay? No, okay. This is, we talk about it. This is the luxator lateral. Yes. You see how it's happened? The tooth gone inside, but the root come out. Sometimes will be laceration here, but in this case, you anesthetize and put the tooth in place. And you put something to fix the teeth, not to move. All right?
But doctor,
At
we
least
should,
2 months.
Here we should extract the teeth.
No,
before, yes?
no. Why?
But
Why?
if you push it, the tooth and this
You
alveolar
take
one-
all this fragment here, take it little down and push it, no problem. Because if the nerve is injured, it is injured already, finish. You have to do endo work after. Just in the beginning, you have put the place in. The first day, try to put the tooth and the bone in place. After you fix, I will show you now how to fix. Okay? Displacement of the tooth into the alveolar bone. This is the tooth is gone inside the bone. Okay, axial dislocation. This is the pressure he received immediately, and it's gone. Intrusion is called this one. Fracture coronal. Look, the fracture will be either in the crown. This is the best fracture here, or will be in the enamel only. Okay, this is the dentine and this is the pulp. It will be enamel and dentine. You can see this is the fracture. This also is good because still we are not approaching the pulp. But the fracture which is involving the enamel and the dentine and the pulp, see the pulp is exposed. If the exposure is very small, we can give chance to the child. Just put calcium hydroxide, cover the area, and do feeling for him, temporary or permanent, and observe. Sometimes this small exposure, if it is clean, the body, the pulp will start doing secondary dentine, and the pulp will become alive. If no response after a few months and still patients having pain, then we have to open and remove the pulp totally. Always need observation. But if it is 1 millimeter the exposure, then you go for pulpotomy. Pulpotomy is removing only the coronal side of the pulp, and we leave the pulp of the roots by certain treatment. We put calcium and we protect this area. Especially if with the children, the apex is still growing, is open. All right. In this case, we do pulpotomy. But if this one is already necrotized, then we have to remove all this one, and we put calcium or MTA, and we give time to the apex to be completed. All right? Okay. Now you are going to see. This is the fracture involving the enamel and the dentine. And this is the fracture, the pulp is exposed. Okay? This is also a complicated fracture with pulp exposure. Fracture without complication. Why I am telling you, if somebody come and he have pain, you do X-ray. In the X-ray, you can see periapical X-ray. You can see the fracture line. This one is involving about the middle third. This is the best fracture. As much it is up, it is good because we need bone support for this tooth. See how much we have bone, little bone, not much. But if the fracture line is here, it's not acceptable. Then we have to take the tooth out. The crown, the broken crown. Sometimes this fracture line need observation. Don't do anything. Just wait. What will happen? The nerves, the vascularity will start coming from lateral area and will happen a new opening, and the tooth will remain in place. It's very important in this case. I have many cases like it. Really, I didn't do any root canal, anything. Just the patient have a new opening in this area, new vascularization, and everything returned to normal. I waited to see the condition, and it is improved. All right, this is the fracture line. This is the classification in the what happened. This is the crown middle third. This one we don't. It is not good. You have to take this piece out, extract, because there is no bone support. This is the middle third in the middle third. This is the cervical area. This is the middle third. This also it's acceptable because we have bone support here, and this one is the best apical third, axial fracture. The axial fracture is if it is come like that. This is the axial. Okay. This is horizontal fracture. Complex therapy. How we treat this kind of treatment? Treatment of injury. If avulsion, it's come totally out, action out of surgery. Always remember, if a parent came to your clinic and he is holding the tooth in his hand, or they call your clinic, tell him if you have milk, put in the milk. If they can put in normal saline, which is available is salt, sodium chloride, physiologic serum, you tell him normal saline. Tell him put in normal saline. If the child is conscious and he is okay, tell him put it in his mouth, but not to swallow. The saliva of the patient is a good place to put. So you have milk, you have saliva, you have physiological saline. There is a medicine it's available. If you have it in the clinic, this is the best one. Dentosafe is a Germany medicine available in the market. Treatment of injury, what you will do? I told you, if it is within 30 minutes, the chance of healing and it is very high. Immediately take the tooth and you clean it, wash it with normal saline, but don't grind, don't remove the ligaments on the tooth. It's important. Just wash the alveolar socket with normal saline, and the tooth should be clean. If it is in the sand or something like that, just clean it, wash it, and immediately put inside.
First we should take out, yes?
The tooth is out. I told you. The patient, the parent brought the tooth and they come to your clinic. You check the root. The root is okay. There is no fracture. There is nothing. Just put in the alveolar socket and you fix it with the neighbor teeth either by composite or by silk or by orthodontic appliance, whatever be, just you fix it. About 3 weeks to 2 months. You decide how from the X-ray control.
When the tooth is out, the nerve is being cut, no?
Yes, I will tell you.
And
We are
the
coming.
tooth will be destroyed after by time. You
Af-
have to do crown.
After at least after 2 weeks, if no vascularity turn, we are going to explain that. You have to now. It is fixed. You open from back and take the nerve out and put calcium inside. Don't lose time. Sometimes if it is past 1 hour, then you open the pulp and the tooth in your hand, remove it and do feeling. Okay? But if it is within 30 minutes, don't lose time. Just put the tooth immediately. We need time, okay? This what I mean. If you come after 2 hours or 3 hours, 15 minutes more, nothing will change. It is already the time passed. So you do the treatment endo out and put in the oral cavity. But in the first 30 minutes, you immediately put the tooth. We will do the endo later, after 1 week or 10 days. In the oral cavity, we'll do it. Okay? So aim, replantation as soon as possible, as I was saying. The ligament and cell lose their vitality after 1 hour. The tooth is attached with the alveolar bone with ligament. Preparation of the tooth and the alveolar socket, I told you, washing it, clean it. Replantation, put the tooth inside. Stabilization is very important. We have many things. You can use silk, you can use composite, you can use whatever you want. Just let the tooth fixed. Using the neighborhood tooth of splinting, the composite, see here, is joined by the adjacent tooth. Acrylic splint, sometimes they do prothese, some prothese to hold the tooth. Composite bonding with orthodontic arch wire. The wires we are using in orthodontic, you can put here over or from back and put composite on the wire and fix it, okay? Brackets, the brackets is the orthodontic bracket. Put one bracket here and one bracket here, orthodontic, and fix it with wire, okay? That also can go. Wound treatment, if there is any wound in the oral cavity, first you put the tooth, then you go for wound treatment. You clean the wound, you suture it. If there is any bleeding in the area, you control the bleeding by using cautery or whatever, or ligation if it is too much bleeding. Usually in this area, the bleeding will stop unless there is hemophilia or which is very rare. The prognosis, maximum 1 hour extra alveolar. I told you the maximum is accepted, the tooth is 1 hour outside. The fixation, look, the patient is 9 years old, that means the apex is completed and closed. If the child is 7 years old and you erupted the central incisor, still the apex is wide and it's not completed, okay? The treatment change. So fixation, closed apex, that means the child is between 9 years old and between 7 and 10 days he come, okay? Open apex, 2 weeks neurovascular re-anastomose. If the apex is closed, between 7 and 10 days, there is possibility that innervation will start. If the open apex, between 2 weeks, if it is open, there is a chance that neurovascular go inside. The chance is very high, and start revascularization, the sensation. Give chance. This is the reason why I am saying, if you implant the tooth, don't take the nerve immediately out. Just wait and see if the patient start having sensation after 2-3 weeks, okay? Don't go fast. Leave the endo work after 2 weeks to decide. In mature tooth with closed apex, if the apex is closed, or immature tooth with open apex, but time elapsed, it is more than 30 minutes. They come to you. In 1 week root canal treatment. I say 2 weeks. Here is saying here after 1 week you do canal treatment. You open from back and put calcium inside. Why? Because he is afraid that the infection in the necrotized pulp will go inside the bone and will start osteoclast. The cells will start تآكل الجذر يعني yes resorption, the apex resorption will start, the osteoclast will start. So to prevent this, it is better after 1 week of implantation you put calcium inside to prevent the initiation of inflammatory root resorption. The inflammation cause the osteoclast and root resorption. Okay.
It's after root canal.
After, no, I told you after 1 week, the chance to resorption will be less. But if you leave it long time, sure, resorption and ankylosis will happen. Okay? Treatment, okay, avulsion, it's totally out. Instruction, pulp diet. You have to ask the child not to use this tooth, just only soft diet. And the tooth cleaning is very important. With a soft brush you have to use. And the most important is the mouth wash with chlorhexidine, 0.1% chlorhexidine. It's very important to clean the area to kill the bacteria. Don't worry if a child, usually with pain, he will not bite on the tooth. Be sure. Supplementary therapy, antibiotic treatment, it's important. If the wound is dirty, it's better to give him tetanus vaccination. Immunization status, okay? Look, I will tell you something. It happened in my clinic with doctors. They refer me children, milk teeth came out. And they told me the parent told me, please re-implant this tooth in the oral cavity. With children, milk teeth, you throw it. We cannot implant milk teeth in the oral cavity. It's very important notice. Don't do mistake in front of the parent, okay? Milk tooth, we cannot implant it. Why? Because we have permanent teeth. If you put this tooth there, then you will destroy the permanent teeth, okay? This is important, you have to know in your practice. Because maybe 10 doctors, they refer to me to implant milk teeth. If replantation is not possible, example in the case of loss of the tooth, they didn't find it. Okay. Temporary solution, we have to put acrylic bridge or orthodontic appliance. What it means orthodontic appliance? We put a wire and a tooth hanged on it, just to, because the children sometimes we don't want when they laugh without tooth. Just we want to put something to be happy, because in the school they will start laughing on him and they will joke on him.
Until the permanent
Psychologically, it's important to replace it. Final solution, the orthodontic treatment, implantation when he is at the age of 17, 18 years old, combined therapy, all this prosthesis or whatever will be, you can do to replace that tooth. This is total avulsion. See what he did here. He prepared this tooth and he prepared this tooth and he did a 3 units. You see, he did 3 units. This is one of the temporary solution. I don't prefer this one. You can do something. You put a tooth here, and there is something called Maryland bridge. The Maryland bridge is one tooth here and one here, and from the back he have 2 wings. You put in the back, and you by composite try to fix it with this tooth and with this one. All right. Only one. Yes, this is temporary. Once he is at the age of 18, we can go for implant, dental implant, because he. I am sure he already prepared the tooth. It is not nice to permanent tooth to be grinded, especially with this age, because small preparation, he need maybe root canal treatment. Okay, because the pulp is big in the children. Healing after replantation, regeneration of the gingiva, revascularization of the ligament start, renewal of the sharp ligaments, open apex revascularization and reinnervation. If the apex is large, I told you the nerve and the blood vessels will start again. High bacterial contamination, healing is limited or impossible. If it is very dirty, the wound, this is radio. Or if the dirty is very dirty, then the healing will be always, even if you give antibiotic and the media is dirty, the hope of healing is very low. If subluxation, the tooth not come out, only change the position. No need to splint for stabilization. Look, with children, if there is subluxation, that's mean the teeth receive the trauma and change the position, I want you to tell you, he will not let you work the child. He will cry and things like that. Just try to push the teeth by hand, gently, and try to put the teeth in the position. Don't do else. Let them go home. The child will not eat on these teeth because he has pain. And after a few days, you will be surprised to see it is stabilized. But with these children, maybe he need after 15 or 20 days root canal treatment because the pulp it is died. And if the pulp is died and you don't do root canal treatment, it will affect the permanent teeth. Okay? The color, how we know that this tooth is died? From the color. The normal white appearance is disappeared and you will see a dark color. Okay? From here you know there is no. And if you have the machine of pulp tester or by cold chlorethylene, you do pulp test. If you don't feel the electronic device, if you put on the tooth, it will show you if the tooth is vital or necrotized. If it is not necrotized, need open and remove the pulp and do feeling for him.
And we do extract here?
In children, if the tooth is, you can put in place, it's not come out, only it is attached with the bone and the gum. Just put in position and leave it. Then the muscle of the lip and the tongue will balance it and put in position.
After a little inflammation or have a dark color, we extract or we...
No, I told you, you treat. The tooth will come stable after, in subluxation. But if totally out, don't implant. Totally out, tell him leave it. Just for psychological, tell him once the wound is healed, you do something temporary for him. Okay, this is one. Subluxation, no need to splint for stabilization. Just put it by your hand. Observation X-ray, 1 year. Why is saying observation? Because if the pulp is necrotized, you can't wait. You have to take the pulp out because it happens cyst, periapical granuloma. Root canal treatment, pathological sign. This is the pathological sign. It means you can see on the apex X-ray, you can see granulation tissue started happening. Lateral luxation, extrusion, we talk about it. Reponation following the injury, fixation for 2-3 weeks. Before we were fixing about 2 months. Now the new study is telling don't fix it long time, because what's happening if you leave it 2 months or 3 months, the ligaments become ankylosed. The tooth will come complete contact with the bone, ankylosed. But if we leave it after, if you remove the fixation after 3 weeks, still the tooth is mobile. You feel it is mobile. But this is better than keeping long time. In this case, 2-3 weeks, we are the ligament movement is becoming normal. No, we are avoiding what we say, the total fixation with the bone, ankylosed. This is the word, ankylosed. The ankylose is very bad because once you want to extract the tooth, the alveolar bone will come out. It will become one unit. The tooth and the bone will become one unit. But if you leave it for 2-3 weeks, it will come to return to normal, the movement. Lateral orthodontic reposition, if we can't do by hand or something like that, we cannot keep the position, just leave it. Once everything is healed, you refer to orthodontist, but then he will do traction, orthodontic traction, and he will put in position. The most important, not to lose the tooth. Okay? Then we will think about it. Root canal treatment in case of the tooth with closed apex. I told you, if the apex is closed in 9 years, 10 years old, something like that, we have to treat, we do root canal. But if the apex is open, wait, maybe revascularization will happen. Okay? This is the open apex. There is a chance of a spontaneous re-eruption. Okay? Closed apex, surgical or orthodontic reposition, split root canal treatment. Okay, we'll speak. This is also something nice. See, here the tooth is broken. Okay, this is called intrusion. It is gone inside. The treatment of injury. It's gone inside. So, if the total crown is not broken, it's not broken. You try by using needle holder or mosquito. Try to move it gently and take it out. Sure, you have to anesthetize. You return the tooth in a position and you fix it with the neighbor teeth. Okay? If the crown is broken and the root is inside, what you can do? You put a screw inside and try gently to take the root out. Every time you change the rubber, you can see now, you change the rubber, then the root will come little out from the alveolar bone. Once it is everything healed and the root came out, you can put metal screw or whatever be, and you build the tooth again. Crown, you see? Okay. This one is called orthodontic or surgical repositioning. Once you put a screw and move it, this is called orthodontic treatment, surgical reposition. Okay. The treatment of crown fracture depends on which third of the crown is injured. If the here, you do only simple feeling. Yes. Here also, you should be careful. Maybe the pulp is necrotized or not. You put a calcium hydroxide here, and you put a feeling. Here in this case, I told you, if it's minor exposure, put calcium and observe. It is more than 1 millimeter root canal total, you take the pulp outside. If the enamel injury, minor enamel polishing, flora, if it is very small fracture, just polish, yes, and keep it like that. Put fluoride. Large enamel fracture, one more composite restoration. Okay. If enamel dentine injury without pulp exposition immature tooth, you put calcium hydroxide liner. Why we have to put? Because it is sensitive. The calcium hydroxide liner will provoke the dentine to form the pulp to form new dentine. It is called secondary dentine. All right.
Doctor, sorry, some of the students have exams.
When?
At 2:30 o'clock.
Okay. Yeah. We are about to.
But can we go because we should go to
How
the
about
oven?
Yeah. I know.
لا لا لدوني وبابورون Two and half.
Let me see how much we have too much.
No, it's all. There's some students.
Okay. So temporary crown we have to do in case if this class 4 fracture or see protective covering, X-ray control, final restoration. We are about to finish. Yes. Okay, wait. The final restoration is if the apex is closed. Enamel dentine injury without pulp mature tooth. Final restoration. This is the fracture. You see what he is doing. Okay. This is the composite, a new filling to replace the broken area. If the parent come with sometimes they will bring you the broken chips as you are seeing here, okay? Then this is the best restoration. Just you put etching, enamel, fixation, fluable composite here and fluable composite here, and you join together. You see, he's doing the treatment, and you put the broken area. It will be very nice. It will be helpful. Okay, his same restoration. You can use it. Treatment fracture, pulp exposure. If the pulp is open, I told you, the size of pulp exposure. The time between the injury and the treatment is important, and the root development. This is the trick I want you to know. This is very important. If the pulp is exposed, the time which the child came, and the root development, the apex is open or is closed. Here you decide what to do for the child. Okay? If it is a small 1-2 hours, open or closed apex, he is telling you direct pulp capping. If it is a small, I told you just put calcium and do your filling. If it is more, the exposure, the pulp is more than 1 millimeter, and the time more than 3 hours, and the open apex, the child apex tooth is not completed, then you do pulpotomy. Pulpotomy, only the crown pulp, take it out, put calcium and fix it. Why? We want the apex to form completely. Okay? If it is large, long time, and close apex, you do pulpectomy. All the pulp should be taken out if the apex is closed. Okay? Direct pulp capping, this is the calcium or MTA, you use it. Pulpotomy, partial or total elimination of the crown and pulp tissue, this is called pulpotomy. Pulpectomy, elimination of all the pulp tissue. You put calcium. Always we have to use calcium. Final root canal filling, close apex. Why we put MTA? MTA is a new product recently used, especially when the apex is open. MTA will provoke complete formation of the apex. Shall we stop or we continue? You tell me.
How many slides?
We are about to finish. We are about to finish.
Okay.
Yes, you can take from your colleague this lecture, and you can continue, please. Okay. Treatment of the injury, fracture. If the fracture is in the cervical area, what do you do? Worst prognosis. Elimination of the coronal part. We take all the crown out. Root canal treatment we have to do. Orthodontic extrusion, I told you put something inside the root and take it out. Restoration, you put a pin inside and you do crown. Extraction and implantation, this one, if there is no more hope and the fracture is very deep, you have to take the root out and do immediate implantation, dental implant. But we prefer the age. Usually we are using for girls 16 years old for implant, and male about 17 years old, 17 to 18 years old. Nowadays, some doctors, they are using 12, 14 years implantation. We don't prefer that because still the jaw is growing. So the fracture, if it is in the middle third, reposition of the coronal part, split 1-2 months. You do root canal filling. Transradicular fixation can be an option. Silver point. What it means, silver point? We are going to see it now. The silver point. See, this is the tooth. Please, there is a pen in the back. You can give me. Yes, thank you. This is the tooth. Okay. The fracture happened here and the fracture happened here. Here there is no attachment, okay? This is the pulp. So what we open from the back and we put silver point. Silver is a metal. We join this one with this one, okay? This metal one piece. Then it do like a splint, this one and this one, okay? In case it was in the back. silver point. This is the silver point, transradicular. He mean this one, okay? If the fracture is in the apical third, he mean here, what you have to do, observation. I told you, if the fracture is here, just wait. The vascularity is now coming from here. That what will be, the vascularity will start coming from here. You will have 3 opening then. Oh, you wait. Don't do anything. In case of necrosis, the color is changed because of trauma, then you do a calcium hydroxide. I told you after 1 week or to 15 days. Final root canal filling after healing, after it is healed and fixed and the patient, there is no more wound, you open from the back and you do your canal filling. But first you use calcium hydroxide to control all inflammation and in the area. If coronal part is dislocated, this is the coronal part. If it is dislocated, reposition and fixation for 1 month. You put in place and you fix it for 1 month with the neighbor tooth, like putting wire here and composite. Okay. This is the soft. This is the fracture. I told you what will happen. You do X-ray, you will see this the same appearance. Here will happen some connective tissue and granulation tissue. It will come normal, vascularity normal. The most important, the patient don't have any radiolucency, no pain. Leave it. It will be like this. New canals will happen here, and the tooth will be alive. No problem. This is the hard tissue. Okay. Peripheral external root resorption. Why this one is happening? Because of trauma. What will happen? Because of the trauma, the osteoclast will start more faster than the osteoblast. Osteoclast is fracturing the tooth, causing resorption of the enamel and dentine. Sorry, I say. شيء ما تاسكو دام ولا شيء بيشنا خوسن يلا باي 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 باي. Trauma with damage to the periodontal structure. Periodontal, you know, the gum and the bone supporting the tooth may not become involved. ماكروفاج الخلايا الكاسرة العظم. Osteoclast خلايا الكاسرة العظم macrophage, which take the bacteria. In case of severe trauma with some degree of displacement of tooth, diagnosis 1 week after injury. You have to wait always. Once you implant the tooth, wait. Don't go immediately for root canal treatment. Pulp tissue, bacterial, rapid prognosis, intrusion, replantation, diagnosis 2 to 4 weeks after the injury, severe cases. He's telling you each case how much time you have to wait. Okay? Please, you read this one, inflammatory root resorption. Because this one usually will happen after 2 to 4 weeks, not immediately will happen, inflammatory root resorption. The osteoclast will start growing here. In severe cases, total root resorption in 1 month. Sometimes the osteoclast will move very fast and immediately, really, you do X-ray, 1 month, the patient will come, the tooth inside after implantation. This we cannot control. You always tell the patient, father, there is no guarantee. I am doing my best, and it's depend on your child. I saw a patient here in Yerevan. I did implantation for him. They came to me in my clinic. There was no tooth, even. They came after 4 days or 3 days, I remember. The boy fall down and they brought me the tooth. They found it below a car. There was a mud and dirty and everything. He told me, I told him there is no hope at all, but if it is my son, I will try. We don't lose anything. He said, okay. Believe me, after 7 years, I saw him here in Yerevan, and the tooth is still in place. In medicine, there is nothing impossible. You try, okay? I tried and I succeeded in this case, and I am surprised it's not written in the books. It's written after 1 hour, you have half minute, 30 minutes, the chance is high. 1 hour more, after that, the hope is very less. I did it after 3 days, and still the tooth, and there is no bone resorption and nothing. And sometimes everything is perfect, and totally bone resorption happen, the tooth resorption.
So it depends about which tissue he have.
Sorry?
It depended about which tissue he have.
Yes, exactly. And his immunity and everything.
Yeah.
There is things you can't understand in medicine. Radiologically, after 2 months, injury to the periodontal observed inflammation associated with invasion of osteoclasts, cement resorption. Okay, you read this diagnosis radiological after 2 months, clinical 1 month, typical ankylotic should for okay. If there is clinical 1 month, typical ankylotic sound for percussion. See, if I hit here, the voice is different. If I hit here, is different. If I hit here, the voice is different. So, in the ankylosed bone, if you hit the neighbor, you will hear voice, and in ankylose, you will hear another voice. From taping, you can know this tooth is ankylosed or no. If it is ankylosed, it's a problem really, because the extraction and things like that will become difficult in the future. Pulp necrosis, the signs, discoloration. How we know that this pulp is necrotized? The color is changed. There is no response for vitality test. Sensitive for percussion. If you hit the tooth, you will feel a pain. Periapical lesion, radiolucency you can see in the X-ray. If 2 of them present, if 2 of this is present, then the root canal treatment with calcium should be done. All right. Let me see how much. Shall I continue or what? It's about to finish, but okay. So how we prevention? Now we're going to speak calcified metaphorical. Okay. How we can prevent? Cover the teeth or the gingiva with children. They have several. There is a device, plastic you put in the mouth during sport, like here, to protect the teeth. Don't influence the relation of the jaw. Do not disturb breathing. Resistant and durable, hygienic, possible application on fixed orthodontic appliance. Protect. This is protectors. Okay, requirement. Prevention, mouse guard. This is the mouse guard. Confidential, prefabricated individual is available in the market, like these things. Okay, for this sport. This is the device you put inside before implantation to be the tooth. تكسب الحيوية بنسميها يعني the tooth will have vitality ready for implantation and clean the tooth. Okay. The elapse after the injury, weeks or months, confused, frightened child. Parent and child don't tell the same story. Don't believe always the same story, because the child is afraid. He will not explain to the parent what happened. So try to know what is the cause of this. Is it a fight or it is whatever be. Yeah. Parents and child don't tell the same story. Anamnesis is not in accordance with the result of clinical examination requiring injuries. If a child come and you can't find the tooth, please you do X-ray. You have to know where is the tooth. Is it lost outside or it is in his hand or whatever be. Because sometimes what happens, especially if the child is coughing, then maybe this tooth is gone in the lungs. Then he need immediately endoscope and take it out. If it is in the stomach, no problem, it will come out. So be careful to count how many teeth is lost. You have to find them, all right? If you have doubt, send him for chest X-ray, because it's your responsibility. This tooth may cause infection in the future, and he will have septicemia and lung pneumonitis, okay? Case report, this one is 20 years old boy, street fight. What happened after the fight? All this, I have many patients like this. After fight or accident or fall down, all this teeth is gone out. I use this one, it's called Eric arch bar. We've put on the teeth up and we fix the teeth on this arch. This arch will hold the teeth in position, all right?
Yeah.
This is oral dental splint, we say. And orthodontic clinic 3 days after, still. أيوه. مين؟ ايه تفضل. ايه هلا اتصل فيك، ما اعرف دكتور تقويم يجي اليوم ولا ما يجي، اتصل فيك اخبرك، لانه ما يجي كل يوم، يجي احيانا يجي. هلا اخبرك بعد شي ساعه اخبرك، يلا، او نص ساعه اخبرك، نص ساعه اخبرك، ربع ساعه اخبرك، ربع ساعه، يلا سلام. Still very mobile apple front teeth. Okay. Radiographs, 13 root fracture in middle third. Look here. All this 13 is, this teeth all is broken. Extrusion. We use this one is the Eric Archbar to fixate all. All upper anterior teeth are very mobile. This Eric Archbar will fix them. Will keep it about from 3 weeks to 2 months. It's according to the fracture line. All upper anterior teeth show vitality. Look, we did pulp test in this fracture line, and still the teeth is vital. No need to do root canal treatment in this case. Okay. See here, you can see started bone resorption. All right. This is what we call osteoclast started here.
What is the black one?
This one, the nose. Okay, nose open. The treatment plan is the slow reposition. If it comes trauma, put the teeth in place, put orthodontic appliance for 1 year. If one of the teeth is died, you do root canal for him. Any tooth, he is not sensitive, after 1 month, you do root canal for him. If the apex is broken, you put a silver point. We don't use too much now, silver point, but in these cases, you can join it with Kutaberka temporarily. Frequent control of all upper anterior teeth. First pathological sign, if you feel any tooth is doing pain or is not sensitive, you do root canal for him during your routine checkup. After the rebonding, fix and removable retainer. After you remove everything, you do for him a retainer, movable retainer. Okay, he can put it in the night or things like that.
A retainer, but
Retainer, or you do this. This is orthopedic. You send him to orthodontist to change the position of the teeth. Okay. This is the silver. You see, this is a complicated fracture. He used the silver point to join this piece. مثل جبيرة يعني.
بالضبط.
If somebody's leg is broken, then to join these two together, it will help. You can put this one temporary. After a few months, you can take it out if you want, and you put Kutaberka in place. Okay.
يعني to become
So-
smooth.
Sorry.
يعني تلحم هذا السن يعني يلحم.
Sometimes it is happening really. You can't understand what's happening.
Yeah.
Yes, you can't find the line. You cannot find the line. And if it stayed like that, a new opening is happening here. New vascularization happening. And the tooth will be vital. See this, the apex resorption, you can see. Then once you see this sign and the tooth is not vital, open and go inside. And do root canal treatment in the future. Take this one out and you do Kutaberka filling. Okay? And this kind of patient need follow up and control. See what, he returned to normal position.
Yeah.
Okay? Alright, we finished. See you next week.